Ever been caught in a conversation where the words just keep flowing, maybe even tripping over themselves and losing any clear direction? Today on the Deep Dive, we're diving into something pretty fascinating in communication called logorrhea. Psychologically speaking, this isn't just someone who, enjoys talking a lot.
Hmm.
It's more a communication characteristic marked by this overwhelming abundance of words
Mm.
and a kind of relentless repetition that can make it really tough to follow.
Yeah, and what's really interesting here is that while you might sometimes hear Logorrhea talked about as its own thing, our sources suggest it's often more like a signpost. It points to something else going on underneath.
Okay.
It frequently shows up as a symptom of an underlying condition, maybe a neurological issue like a brain injury, or perhaps a mental health concern.
Okay, let's unpack this a bit then. Our sources seem to highlight a pretty significant connection between logorrhea and something called Wernicke's aphasia. Now, that's a specific type of brain impact, right? It affects how
Yeah.
we process language.
Exactly. That specific area, Wernicke's area, it's crucial not just for understanding language coming in, but also for that internal monitoring of our own speech as we produce it.
Ah,
The
okay.
damage there can disrupt the ability to sort of hear and correct our own words as we speak.
Mhm.
This can lead to problems with what our source calls self-centered speech.
Self-centered speech,
Yeah.
like an internal feedback loop.
Precisely. Think of it like that feedback loop that usually helps us stay on track, makes sense when we talk. When that's disrupted, well, things can go off course. So our mission today really is to get a clearer picture of logorrhea. What does it actually sound like? And what are some of the, neurological and psychological factors potentially involved?
Right, so when we talk about this description,
Yeah.
rapid, uncontrollable, and incoherent speech,
Mm.
what does that actually sound like? Because just talking quickly isn't the same thing, is it?
That's a really important distinction to make. Yeah. While sometimes the speech in logorrhea might have a, let's say, relatively normal rhythm and just be a bit faster than usual,
Yeah.
there are often other telltale signs. Well, our source mentions the appearance of neologisms. These are essentially new words, ones that don't have a clear origin or, a shared understanding. They even give an example. Instead of saying hippopotamus, someone might come out with something like hippodomatius.
Hippodomatius. Okay, that definitely gives you a sense that something's different. So it's not just the sheer volume of words, but sometimes the actual words themselves are off.
Precisely. Or you might hear words that just seem completely out of place, meaningless in the context of what's being discussed. And in more extreme cases, people might even create entirely new word structures, new sentence arrangements that don't really follow standard grammatical rules. The sources describe it sometimes as a stream of unchecked nonsense that often feels very pressured, very urgent.
And it sounds like often the individuals experiencing this,
Hmm.
they might not even be aware that what they're saying isn't making sense to others.
That's a key point, yes. That lack of self-correction, combined with something called circumlocution, which is where you talk around a word you can't quite find, it strongly suggests a reduced awareness of grammatical errors or just the overall coherence of their speech.
Hmm. To really get a handle on what this looks like, our source gives a couple of really insightful examples. The first one involved a patient with a milder form of Wernicke's aphasia. They were asked a really simple question. Tell me what you do with a comb. Now, you or I would probably say something.
I comb my hair. Something simple.
Right. But what was this patient's response?
Oh, it was surprisingly detailed. The patient said, and I'm quoting here, "What do I do with a comb? What do I do with a comb? Well, a comb is a utensil or some such thing that can be used for arranging and rearranging the hair on the head, both by men and by women." And it goes on. One could also make music with it by putting a piece of paper behind and blowing through it. Sometimes it could be used in art and sculpture, for example, to make a series of lines in soft clay. It's usually made of plastic and usually black, although it comes in other colors. It is carried in the pocket or until it's needed, when it is taken out and used, then put back in the pocket. Is that what you had in mind?
Wow. Okay. The grammar is okay. No made-up words there.
Yeah.
But just an absolute flood of unnecessary detail for such a straightforward question. You really get that sense of an unchecked flow of words. It's almost like their brain is trying to answer in every possible way, even the irrelevant ones. It highlights that lack of filtering, doesn't it?
It really does. Now, the second example is described as more pronounced. A different patient asked why they were hospitalized, and this response is quite different.
Okay, let's hear it.
The patient said, "Is this some of the work that we work as we did before? All right. Quaid new sentences. From when wine meaning why I'm here. What's wrong with me? Because I was myself until the Taysons took something about the time between me and my regular time in that time. And they took it started with me no time. And I began work of nothing else. That's the way the doctor find me that way.
Yeah. Yeah, significantly less clear. Here we definitely see those neologisms the source mentioned. It explains Tayens was likely the patient's word for stroke.
That's what the source suggests, yes. And regular time apparently meant something like a regular bath.
Right. And the sentence structure is really fragmented, broken up. It's much harder to even grasp the general meaning they're trying to convey. It's quite sobering, actually, to hear how profoundly language can be disrupted. Really highlights how complex this ability we take for granted is.
It really does. This second example shows how significant logorrhea can become with that breakdown of coherent language on multiple levels. It just underscores the impact of that underlying brain dysfunction.
Okay, so we've seen what it can look like. What's actually happening in the brain? Or, more broadly, what kind of conditions or causes are associated with logorrhea?
Well, neurologically, our sources point to a few key areas. Traumatic brain injuries, TBIs, particularly if they affect the frontal lobe that's been linked to it. Also, lesions in the thalamus. You can think of the thalamus as a sort of central switchboard for information in the brain. Damage there can affect the smooth flow needed for coherent speech.
Makes sense.
And there's also mention of disruptions in the ascending reticular inhibitory system. That system helps us maintain focus, regulate arousal levels, sort of like the brain's filter an on-off switch for attention.
Ah, okay.
So issues there can contribute to that rapid, pressured speech sometimes seen.
And that strong connection to aphasia keeps coming up. Can you explain that link a bit more?
Certainly. Aphasia, just generally, refers to a neurological impairment of language abilities, reading, writing, speaking, understanding that results from some kind of brain dysfunction. And it's important to note, a formal diagnosis of aphasia usually excludes situations where other cognitive or emotional conditions are the main driver of the language issues. But logorrhea is indeed a very common characteristic of Wernicke's aphasia, which, like we said, involves damage to that key language processing area. And alongside logorrhea and Wernicke's, you often see other related language issues, things like circumlocution, which we mentioned.
Talking around words.
Exactly. And paraphasias, those are like linguistic slips where the intended word gets swapped for one that sounds similar or is related in meaning, but it's incorrect, like maybe saying fork when you mean knife.
Okay.
And, of course, those neologisms, the made-up words we talked about.
So it's like a whole cluster of language symptoms, and logorrhea is a prominent one in that specific type of aphasia. But it's not solely a neurological issue, is it? The source also mentioned psychiatric and other neurological disorders.
That's correct. Logorrhea isn't exclusive to brain injury or aphasia. It can also be associated with conditions like tachypsychia, that's essentially racing thoughts, also with mania, hyperactivity, even catatonia in some cases. It's also been observed in some individuals with ADHD and with schizophrenia. I think the crucial point here is that if someone is exhibiting excessive talking, especially if it's combined with things like hyperactivity or other symptoms that might suggest mental illness, maybe hallucinations, it really warrants a proper medical evaluation by a professional to figure out the underlying cause.
That absolutely makes sense. So if someone is diagnosed, if logorrhea is identified as a symptom, what does treatment typically involve?
Well, since logorrhea itself is usually the symptom, the treatment really focuses on addressing whatever the root cause is.
Right, the underlying condition.
Exactly. So, for instance, in individuals who are experiencing mania, maybe as part of bipolar disorder, antipsychotic medications or mood stabilizers like lithium are often used. These help stabilize the mood, reduce those racing thoughts, and that, in turn, can help regulate the speech patterns, reducing the logorrhea.
Okay.
However, our source brings up a really interesting and kind of delicate point when it comes to individuals with brain lesions causing the logorrhea.
Oh, what's that?
It mentions that trying to directly correct their speech errors, pointing out that they're talking too much or that the words aren't right, can actually be quite upsetting for them. It might even lead to frustration or anger.
Why is that?
Because the damage to the language processing areas might mean their brain genuinely isn't able to recognize that what they're saying is incorrect or excessive. They might perceive their speech as perfectly normal.
Oh, no.
So a very direct speech therapy approach focused purely on correction might not always be the most effective or, frankly, the most compassionate strategy in those cases.
That's a really important factor to consider, the person's own awareness or lack thereof of their communication difficulties. Finally, our source just briefly touches on a few related terms. Could you maybe give us a quick overview of those, just to provide a bit more context, see where logorrhea fits in the broader landscape of communication challenges?
Sure, happy to. Briefly then. Cluttering is mentioned. That's another fluency disorder, often involving rapid, disorganized, or jerky speech. Compulsive talking might be seen more as a personality trait, maybe linked to anxiety sometimes, but generally less severe or incoherent than logorrhea.
Okay.
Gibberish, well, that just generally refers to nonsensical speech, could be from various causes. Glossolalia is often associated with religious practices like speaking in tongues, unintelligible speech believed to be spiritual.
Right.
Then there's graphoria, basically the written equivalent of logorrhea, producing rambling, often incoherent writing. And finally, schizoaffective disorder and schizophrenia are mentioned again as mental health conditions where logorrhea can sometimes be present as a symptom, among others.
Okay. So quite a spectrum of related but distinct communication challenges there. Well, this deep dive into logorrhea has been truly illuminating. It's just fascinating how something we often take completely for granted, our ability to communicate clearly, concisely, can be so profoundly affected by these neurological and psychological factors.
Yeah, absolutely. Logorrhea serves as a really compelling illustration of that intricate connection between the brain, our thoughts, and how we manage to express them through language. And it really highlights that critical distinction you raised earlier, the difference between simply being talkative, maybe naturally effusive, and experiencing a genuine communication characteristic marked by that loss of control and that potential for incoherence.
Yeah. It leaves you with a final thought, doesn't it?
Hmm.
For you, the listener, to maybe consider. Think about just how many incredibly complex processes must be constantly working away in our brains, usually seamlessly, just to regulate our everyday speech. Everything from choosing the right words, to following grammar, maintaining a natural pace, monitoring ourselves. When those processes get disrupted, the sheer variety and complexity of challenges like logorrhea really make you appreciate the delicate balance required for the simple act of talking to each other.